afternoon, and welcome to Psychedelics Today. I'm Court Wing, the host, and we have a very unique episode discussing a upcoming, soon-to-be-released case study called Long COVID Symptoms Improved After MDMA and Psilocybin Therapy, a case report. So what I'd like to do right now is introduce our guest. So first up, we have Dr. Monica Verduzco-Gutierrez, who is an accomplished academic physiatrist, professor, and chair of the Department of Rehabilitation Medicine at the Long School of Medicine at University Texas Health, San Antonio. She previously was a medical director of the Brain Injury and Stroke Program at a top 3 U.S. News and World Report Best Hospital for Rehabilitation. Her area of clinical expertise is the care of patients with traumatic brain injury, stroke rehabilitation, and interventional spasticity management. Most recently, she has developed a post-COVID recovery clinic to help those who were diagnosed with COVID-19 and suffer from various physical, cognitive, and functional difficulties. Our next guest is Dr. Joel Castellanos. Dr. Castellanos is a board-certified physical medicine and rehabilitation and pain medicine physician and serves as medical director of inpatient rehabilitation. An associate professor in the Department of Anesthesiology at University of California, San Antonio School of Medicine, Dr. Castellanos instructs pain medicine fellows as well as medical students, residents in their pain rotations. He is board certified in physical medicine and rehabilitation and pain medicine, and is the co-founder of the Center for Psychedelic Research, formerly the Psychedelic Health and Research Initiative at University of San Diego. MaryAnn Welke Lesage is the Director of Enterprise Architecture at University of Ottawa and has a specialty in diversity, equity, and inclusion, and is the subject of our talk today. So going from there, to describe what we're looking at today is we had this initial meeting nearly 2 years ago with MaryAnn and myself, approximately a year and a half ago, I would say, though time sort of flies in COVID times. And this was a confluence that happened within everyone meeting around this within 24 hours, I would say, 24 to 48 hours. MaryAnn and I met on a parents forum for people that were exploring the use of psychedelics. And she described that she had recently recovered from a very intractable case of long COVID via doing therapy with MDMA and psilocybin. So we immediately began dialoguing at that point. And within 24 hours of that period, I reached out to Dr. Castellanos. Dr. Castellanos has one of the most noted papers currently cited in the world on psychedelics and chronic pain, which was Chronic Pain and Psychedelics, a Review and Proposed Mechanism of Action. He and I we've had many interactions before, as you may all know about from my work in Remap Therapeutics. But fascinatingly enough, within a day of that initial contact, he heard from the medical director of PHRI, Dr. Timothy Furnish, who had read an article in The Atlantic and about the possibility of psychedelics and long COVID coming together and where there might be an issue in the default mode network. Simultaneously, though, prior to all this, I had already been in contact with Dr. Gutierrez, as she's an expert in spasticity, and I had been investigating some background effects from taking psilocybin causing tremors that seem to be corrective. as well as knowing that Jim Harris, who is a spinal cord survivor who was featured in Outside Magazine, had also experienced notable tremoring in some of his sensory and motor recovery. So it had been something I've been reaching out to her, and then I realized somewhere in the middle of that we were seeing a possibility for long COVID, possibly, though I deferred to everyone else's experience and expertise here, because it seemed that it was also being useful for um, TBIs, so traumatic brain injury, that we'd been seeing in veterans, and that it was also helping with inflammatory conditions. So, based on all of that, everyone decided to, coordinate together. Very fortunately, they let me stick around, and we began our interview process and going through MaryAnn's medical background, and then it was submitted to a couple of journals, and then Dr. David Javitovsky and Dr. Hamarn Chopra, who are physiatry residents at, pardon me, NYU Langone, as well as Johns Hopkins, um, submitted the paper as a poster presentation at the Eastern Pain Association, where, surprising everybody, it took first place. So, coming to now, it has been accepted for publication and gone through its final reviews and edits. So, MaryAnn, if you wouldn't mind sharing with us how you developed COVID and what your symptoms were like while you had the long COVID, and then how those transformed post dosing, if you don't mind.
Yeah, sure. Thank you very much for having me. Um, I was initially really quite hesitant to kind of go public about my story, and I think for kind of obvious reasons, given the legal status of the medicines that I used. And it wasn't until I met you, Court, at the Planned Parenthood Integration Circle that I kind of had the opportunity to contribute to science as a layperson. But I want to make it clear that my motivation is about contributing to helping nudge the medical community towards clinical trials and rigorous analysis, and it's not a suggestion of medical treatment for anybody. My story is very personal, but the reason I'm kind of telling it very publicly today is because of the potential, the possible potential to help millions of people suffering from long COVID and potentially many other types of disorders and diseases. So my story with long COVID starts in early 2022, and my initial COVID infection was really quite typical. It had all the typical symptoms, starting with sore throat, cough, fever, malaise, headache. Headache was a standout symptom for me for sure. And it also seemed to resolve within a couple of weeks from a respiratory perspective, like a normal infection. Also, I was really not expecting to have any kind of complications out of it. That turned out not to be the case. But I, as the initial symptoms were starting to resolve, a whole kind of new and different set of symptoms started to emerge. So the headaches were not getting better and sometimes getting worse. I had constant, really insane pressure in my head that wouldn't let up. The headaches were severe. I've been a migraine sufferer for my whole life, so I know severe headaches, but this was a different kind of headache, and it was nearly constant. And I also had a lot of anxiety and depression that was like nothing I had ever experienced before. It's actually given me a whole new level of empathy for people who suffer from this kind of thing, and it is part of the like kind of the long COVID symptom profile. So after the initial acute infection symptoms had started to resolve, I was left with these intractable headaches and head pressure and anxiety and depression, and it just wouldn't let up. I did attempt to return to work during this time, which failed dramatically. I had such low energy that I couldn't really engage in any physical activity without having big crashes. And I had some pretty major cognitive impairment in terms terms of reading and understanding. And this was quite a contrast from my life before, where I was, a director of IT. I was a PhD student on the side. I was doing a lot of technical reading on a daily basis, and during the worst part of the long COVID, I couldn't read barely at all without needing a sleep, which was really quite shocking and scary, really scary for me. Um, so I had had no exposure to psychedelic medicines before this at all. And it was the kind of the headlines and the research about psychedelic medicines for anxiety and depression that caught my eye. And to the best of my ability at the time, I looked into the research that I could, and that was the reason why I decided to try it. I was desperate at the time. There was no treatment. There was not a lot of help from my doctors, and I was pretty desperate. And that was the reason why I initially started to experiment with MDMA and psilocybin, was to see if it could help me in that way, which it did dramatically. But much to my surprise, it also really extremely helped with a lot of the other symptoms, most notably the pressure in my head and the headache, in addition to relieving the anxiety and depression that was uh, associated with it. So this was like a pretty surprising finding for me. And it's I I approached it with an experienced guide with these medicines who helped me develop a protocol. I started following the kind of sage advice in the psychedelic community of start low and go slow. Started with a 1 gram dose of psilocybin mushrooms at home with my husband, and that was kind of in preparation for a larger experience that was guided with a standard dose of MDMA and then 4 grams of mushrooms, all spaced out over like around 2 to 3 hours.
And
Um,
could I just
mhm.
highlight, you were psychedelically naive at that point, right? You had never done
Yes,
psychedelics before in your life.
yes, yes, absolutely. Yeah.
Okay, thank you.
Um, so following the experience, the results were really quite dramatic and almost immediate. The relief and the pressure of my head was almost like popping a balloon and just letting the air out, and just relieving the pressure in my head, which didn't it never really got back to the point that it was before. Um, and I was pretty cautious in the week following, in terms of I felt a lot better, but I knew I had had experience before with starting to feel better and then having major crashes afterwards. So I was pretty careful, but I started to do some swimming laps, which is what I like to do as far as exercise. And one day I started with 5 laps and that seemed to be okay, no crash. Next day, 10 laps, that was okay, no crash. Next day, 20, next day, 40, and I was back to kind of the regular routine. And it was shocking. I couldn't believe it. And that's when I knew
And
in my
and
heart that I was going to get better. When I could exercise again without having a crash, that's when I knew that I was on the path to recovery.
and
um,
these crashes prior, this post-exertional collapse that was going on in the month of May before this happened. When you say crash, you mean out for hours or even days, correct?
yes, absolutely. Yes.
Like
Um,
dog walking would take you out.
yeah, at least hours and sometimes days. Yes. Um, and of course that I was on long-term disability. I was unable to participate in my family's life. It was absolutely like devastating and desperate time for me. Which is why I chose to go this unconventional route. And I'm just really, really happy that we were able to make this connection in the hopes that this kind of thing is studied in the future, so that it could possibly help more people suffering from long COVID.
And just one other thing I would highlight, when you mentioned like the difficulty in reading, it's like you used to read uh, hours at a time, dense technical, subject matter for, your PhD as well as IT director, and then suddenly 5 minutes of reading would just completely take you out as well, correct?
Yeah, and like it varied in terms of how bad it was, but yeah, it was extremely exhausting and often would trigger a crash. And that was one of the other things that happened within a week or so of the kind of the main big psychedelic experience that I had with the MDMA and mushrooms was that I casually just read a book over the weekend, and which is what really quite normal behavior for me before having had COVID, but I just being able to do that without even noticing, that was a huge milestone in recovery for me in terms of returning to my previous capacity.
And just the last thing to highlight there in the pre-dosing symptom profile, when you say anxiety, right? You're not talking about like a little worried. You had a huge anxiety attack, which you assumed was a heart attack at that point or a cardiac condition, correct?
Yeah, and I really didn't have much understanding of how bad that can really get until that experience, and so yeah, there it was probably like around 3 or 4 weeks after the initial infection, and the level of anxiety raised to the level where I thought it could be some sort of cardiac event going on, and I went to the hospital and had a whole bunch of tests done at that time. And yeah, the result was is that it was anxiety, and I really had no idea it could get that bad. Like I knew cognitively you hear about this kind of thing, but it's really different when you experience it yourself.
Well, thank you so much for sharing that. And, grateful you were able to recover the way you did.
Thank you.
Um, so, Dr. Gutierrez, I have to apologize. I feel like I completely undersold your credentials and what you've managed to accomplish. And as I was trying to whip through my intro there, but in fact, you have testified before Congress multiple times at this point on the effects of long COVID in the United States. Our co author on, I believe, multiple meta studies about post COVID sequelae. And you recently were rewarded or awarded, sorry, a very a large enough NIH grant, uh, a large enough NIH grant for your long COVID clinic down there. Would you mind please sharing with us what is long COVID and what we're seeing going on?
Right. So, as far as long COVID, I think there's different definitions kind of where you look, but you know, I would say that it is considered an infection associated chronic condition. So, other types of infections have caused long term effects. And so, this is just another one now that we're seeing in huge numbers. But, patients will develop signs, symptoms, conditions after having an infection with SARS-CoV-2, which is, the virus that causes COVID disease. And I take it as sometimes patients didn't know if they for sure had it because maybe they got it early in the pandemic before there was tests. We still listen to those patients. We still, make sure that their conditions are addressed, and it lasts anywhere from, depending on the definition. Some say 4 weeks, some say 3 months, and it can be a couple of different things. So they can have symptoms that develop, and there's studies that show there's 200 plus symptoms. So really, I say if a patient comes in with long COVID, you've seen one patient with long COVID because everyone's kind of presentation and sequela is a little bit different. And some may have like persistent symptoms that continue. Some may have got a very mild case or asymptomatic case of COVID, and then new symptoms develop that they didn't have before. Or they could have exacerbation of underlying illness that maybe, they had something like prediabetes and then become diabetic. Or, they maybe developed autoimmune disease. So a new disease state can happen. And so it really is just, there's conditions, there's diseases, there's symptoms and signs, there's, development of maybe things like dysautonomia or POTS, developing psychiatric conditions, developing migraines, having worsening of migraines, like some of the stuff that we heard. Well, MaryAnn's actually headache was much, much different than migraines that she had before. And so they said, like, if you have a little bit of something, COVID's going to be this igniter fluid that just makes everything, because of the inflammation and the cytokine storm and the microclots and the everything else that happens, worse. It's just not good for anyone's system.
And in terms of, so you mentioned a couple there, in terms of what are the primary mechanisms of action for long COVID, like dysautonomia, would you, and microthrombosis, and like there's endothelial cell disruption, and I believe they're now talking about problems with absorption through the gut because of not being able to bring in neurochemical precursors like, say, tryptophan and stuff. Can you kind of highlight how these common mechanisms of dysfunction contribute to such a variety of symptoms,
Right.
and why it may exacerbate pre-existing issues?
Yeah. So great. You hit a lot of them. So,
Sorry.
I love it. So first is like, there's a thought, like, is there some viral persistence? Is it still, there's pieces of the antigen of the SARS-CoV-2 that's in the system that's going to be, triggering an immune response. So it's almost like there's actually, is it like triggering a hyperimmune response? Or in some people, their immune response isn't fighting it, kind of thing. So some people's immune response is too much. Some people's immune response is too little, because it impacts like the immune system as well. We know it impacts the complement system. So then that can drive like your body haywire. The other thing we know that there is, like you said, neuroendocrine dysfunction. There is, vagal nerve dysfunction. We talked about, and that is all tied into the abnormal tryptophan, the abnormal serotonin that's like less. And if you don't have that in your system, yes, then someone can definitely have an exacerbation of some of their, neurocognitive symptoms as well. And the biggest, is our whole sympathetic, parasympathetic in our body, fight or stuff. And then, yes, microclots, endothelial dysfunction. I say, if this is really a vascular endotheliitis, your vascular system's everywhere, and there's more studies on like leakiness of the blood-brain barrier that they've seen as part of long COVID. So we're talking brain, we're talking vessels, we're talking, everything's affected.
Wow.
I'm always like the bringer of good news, not.
What is the estimate? What is the estimate of the number of people in the United States that likely have long COVID?
I think that probably we get some of the best data right now from the Household Pulse Survey, which the most recent one that came out from the beginning of the year, I think it was like January, February timeframe, saying about 6.8% of Americans right now actively have long COVID. When you look at the percentage that have ever had it, it's something closer to like 17 or 18% of people in the US have had long COVID. And so those are at least, the numbers here in the US that we can get. But that's a good amount of people that are actively had long COVID. And there was a Pew Research study that just came out actually a few days ago showing that when they looked at, 10,000 people, that still 22% of people said they didn't know what long COVID was.
Mm-hmm.
It's and not to be exclusive, we can expect to see similar percentages of the population up north in our friends in
I know,
Canada.
in Canada. I was like, oh, I don't know all the Canada numbers, but it's going to be the same, right? Numbers come out across the board.
Well, thank you very much. Just can't tell you how much I appreciate you engaging with me the way you did early on, when I was trying to get a sense of like what's happening. And it's like, if you hadn't been putting out the quality of information, I would say daily, on your feed. It's like you made it impossibly easy to find the right info that was necessary, and like try to string things together. So I really just thank you. So moving forward from there, so Dr. Castellanos, how does long COVID fit into what we already know about psychedelics and pain and inflammatory medicine and conditions?
Yeah, I mean, before we get into that, MaryAnn, I really want to thank you. I think it really does take a lot of courage to come forward and tell your story. Um,
Thank you.
the people in this space have been underground for a long time and have been shunned, and it's because of people like you and people like Mark Geyer and the people at Cluster Busters who have continued to stay passionate about this and have the courage to explore areas of research that are taboo, or that have kept it alive. And you know Dr. Gutierrez and I are both physical medicine and rehabilitation physicians. Um, Many people don't know what physical medicine and rehabilitation physicians are. The acronym is PM&R. We're known as physiatrists. Every day we see patients who have had the worst things happen to them, whether it's a spinal cord injury, a brain injury, a stroke, an amputation, a burn. And because we're seeing these patients and helping usher these patients back to some semblance of a quality of life, it has allowed us to develop these nuanced and kind of a myriad of clinical tools to be able to help patients who are going through a lot of different things. For example, patients with traumatic brain injury have a lot of the same symptoms as patients who are suffering from long COVID. And I just want to plug PM&R as a specialty because we're really unique in our ability to deliver efficient patient care by managing multiple symptoms and not having to refer out to 8 different specialties for 8 different organ system problems. And I think in that way, we're really able to advocate for very vulnerable patient populations in a way that is very inclusive. Okay, I will now step off my pedestal on why
No,
PM&R is the
I think
best specialty.
physiatrists are absolutely awesome. After learning about you guys, it's like that could have been a whole different lifetime. But
I love it. I love it. Yay for bringing it up. Yes.
Yeah.
it's fascinating, and I just want to highlight, both of these people here are department chairs, and so it's just been a gift, working with you all, and seeing what has come as a result. So, and everyone
So,
knows my love for Joel. So, I'm trying not to gush, but anyways.
and Court, I think that, every time we do one of these things, and you are vulnerable enough to show your emotions, this is emotional. These are things that are profoundly affecting people's lives. Whether, any of these patient populations that I just talked about. And MaryAnn, I think you brought up a good point that going through this gave you a newfound compassion for patients who are suffering. And when, as a PM&R physician, you see these people who are really floundering in their lives because these type of things aren't in the life plan. You don't expect to be completely, disabled or like really knocked on your ass, kind of like from out of nowhere. And we need to develop a better system that delivers care and delivers resources to these super vulnerable patient populations in a compassionate way and in an empathetic way. On going back to how we think this fits in with psychedelic medicine, long COVID with psychedelic medicine. There was a very eloquent paper published back in October of 2023 by a group out of Penn that it's one of the best papers I've read in a long time, that really, broke down and made a very strong argument for how the serotonergic system at multiple different levels is really at play in patients who develop long COVID symptoms. The persistent viral inflammation not only impairs and decreases plasma serotonin levels, it also impairs tryptophan absorption in the gut, which in turn decreases serotonin production, but also impairs serotonin storage through that hypercoagulability. And so when you're postulating that a lot of these symptoms that are resulting in, cognitive fog, headaches, anxiety, depression, and you're attributing it all to a serotonergic system, it just makes sense that a serotonergic agonist may modulate those symptoms. And that's exactly what, classic psychedelics are. They're serotonergic. They work on, the serotonin receptors, specifically the serotonin 2A receptors, which has downstream effects on decreasing inflammation in the central and peripheral nervous system. It acts to upregulate genes associated with learning and neuroplasticity. And then it also resets our neural connections to a more efficient and healthy default mode network. And when you think about not only patients with long COVID, but anyone suffering from a chronic condition, a chronic neuropathic condition, those neural networks get really strong because that patient is basically practicing those symptoms every day. And the ability of these serotonergic substances to be able to reset those neural networks is what I postulate on why a single dose can have such prolonged effects, because we're kind of letting those neural networks get back to the basics and almost unlearn that unhealthy pattern of neuronal firing. In kind of preparing for this podcast, but also, working with MaryAnn and preparing this case report for publication, this translates to other things. And I started to look into, what are serotonin levels in patients who have prolonged symptoms after a concussion? And it's low. It's really, really interesting. The more we kind of look into this, that the serotonergic system, both centrally and peripherally, seems to be at the heart of a lot of these symptoms that patients develop. And we're starting to learn through psychedelic research that is one way of modulating that system, and also gives patients a little bit of a different perspective in what they're going through. And so those are the things that really excite me about the potential of psychedelic substances in helping patients who are suffering from a myriad of symptoms. It is still very early. We are still in the infancy of creating this paradigm and really answering the question, yes or no, is this something that works? I think that it is great that we have anecdotal evidence, that we have people like MaryAnn who it has helped. And that means something, that because that is very impactful for those individuals' lives. And if we can leverage that grassroots knowledge to help hone in on the correct patient selection and also the correct paradigm on what we use, like what is the correct dose? What do we combine the psychedelic therapy with? Do we combine it with things that we know work for headaches, or that we know work for vestibular dysfunction, or we know work for aphasia, or whatever it is? And that's where I think the meat of this whole matter is, and where it's really exciting, and it's going to be an exciting couple decades, I think.
So, please, Dr. Gutierrez. It looks like you were about to say something.
No, I'm even learning,
Kind of in preparation for this, and since I've been frankly obsessed with this case study since it kind of came out, and getting ready for this, there are some interesting papers that kind of make very close to what, right in parallel with it. And so just fascinatingly, okay, where are you? So here's one that came out in a study from 2021. Severe COVID-19 pneumonia is associated with increased plasma immunoglobulin G agonist autoantibodies targeting the 5-hydroxytryptamine 2A receptor.
I mean, that's just intuitive, Court.
Right? Yeah, it's like for those that don't know in the audience, though, especially this audience, I suspect everyone knows 5-HT2A is the primary serotonin receptor that psychedelic activity is seen to be active upon, but also it's also the same receptor that's responsible for persisting descending inhibition even past nerve damage. So, right off the top, it's like, okay, if we're talking, as Dr. Gutierrez was saying earlier, about these like nerve pathways and cellular pathways, and then as Joel said, where we're seeing like this repeated experience of dysfunctional regulation of the nervous system becoming entrenched, whether that's in pain or dysautonomia or something like that, it sort of starts to make, for me at least, a kind of a tighter reason why, okay, this is why we're seeing this happen here. And then based on what actually both of you brought up independently about dopamine, so that we've got the gut inflammation where there are, by the way, tons and tons of serotonin receptors. And we see that endothelial dysfunction and the gut wall inflammation preventing the absorption of tryptophan, which then produces dopamine, right? Which is then going up once again the vagus nerve, responsible for this neuropsychiatric stuff. MDMA combined with psilocybin, that's a very classic thing in underground practitioners, right? But it's interesting that it's MDMA is neurochemically promiscuous, not only serotonin, but also dopamine, also norepinephrine, right? And some of the secondary messenger pathways. So is it, it's like, okay, this is what the hippies have been doing forever, right?
Yeah.
Why? And then suddenly we come to MaryAnn and like, she meets a underground therapist who frankly became an underground therapist because they had traumatic brain injury. Mm-hmm. They had severe traumatic brain injury, and these medicines, really helped with her symptom resolution. I can tell you, I'm a different person since I went through the NYU trial in terms of dysfunction. So
Yeah, I mean, my research brain, I wonder, MaryAnn, and I mean, you may have thoughts on this as well. Do you think your response would have been as robust without the MDMA and just the psilocybin? Like, what role do you think the MDMA played in your path to recovery? And you may not be able to answer that.
Yeah, I think that's kind of impossible to answer because I didn't have the opportunity of doing it a different way, right?
Hmm.
But the MDMA was very significant for me in terms of the overall experience, I think. But what impact that actually had on my specific physical symptoms related to long COVID, it's like impossible for me to answer. Um, but on the kind of an emotional, spiritual, metaphysical level, I feel like that the interplay between MDMA and the mushrooms was hugely important.
Hmm.
And we haven't had a chance to talk about that yet, but I do um, like really strongly believe that these medicines are they're more than medically useful. There's a lot of promise in the medical applications of them, but they're also a whole lot more. And it's kind of created a pretty seismic shift in my personal and professional path. And the university that I happen to work at has a really, really unique program. It's a Master's of Arts in Psychedelics and Consciousness Studies that I'm doing right now that looks at it from like a multidisciplinary perspective. So from psychology, anthropology, history, looking at indigenous perspectives and all those good things. And so, indigenous peoples have known about the healing power of these medicines forever, really. And so there is a lot of other perspectives there, and I think there's a lot of potential in so many different applications, in addition to the medical ones.
Yeah, I mean, I agree. I think my first psychedelic conference that I went to, I'm a physician. I'm used to going to medical conferences where everyone is dressed to the nines and it's very professional and it's very serious. And my first psychedelic conference, I was like, oh, man, people are just coming how they are. But I sensed that excitement and that passion, not only in the clinically oriented talks and discussions, but also in how to change like corporate structure. Like everyone was like, hey, like these substances can make the world better in a lot of different ways. And I that is something that is a recurring theme when I talk to people about this stuff is that typically it is one of the top five most profound experiences that people have.
Yep.
And if we're ignoring that, then we are ignorant.
Absolutely. That was absolutely the case for me. Like I would put that experience like kind of right alongside the births of my children in terms of the personal transformative power of it and the kind of mystical experience aspects of it, which are really, really important, I believe.
And first, I just also am very thankful that Marianne's here and that she's chosen to, share her story. And I love her background and to hear all like how educated she is and how she's like getting this new, learning more into to everything that's being done. So just and then the other thing just to bring out about her story is most patients with long COVID, they're not, miraculously recovering.
no.
And like to
Right.
hear how she was and then how she could just flip out of it and how she said I could do this many laps and this many laps, it's almost really unheard of.
Yeah, the balloon popping metaphor i- is is a great way to describe it. I mean, I think that it's like, oh my, like it's just like this release.
Hmm. That's exactly what it felt like.
Where would you see this type of so where would you see this type of research progressing, Dr. Gutierrez, in terms of how would something like this kind of, and please, everybody, but just because this is, absorbed so much of what's become your career, how would you see like an investigation into this progressing? Or
So we really need someone with deep pockets to just, put money into it. I think that's what we're seeing, a lot of investigator initiated work. That's, NIH Recover has been really slow on the treatment trials. They're kind of trialing more traditional things, whether that be, or like Paxlovid or therapies, or it's like, well, we already know, cognitive physical therapy. We need something groundbreaking, something that's going to change people. And so that's where it's like, I know some people have gotten large donations from, very wealthy individuals who are able to fund projects, able to fund really impactful work. So that's kind of like, all right, who's ever on this call your richest friends. Let tell them.
Yeah, I mean, I think the NIH is starting to wise up. I think that they're starting to kind of see the light a little bit as well. I think that maybe not so much in the long COVID space yet, but you look at like what the DoD and DARPA is starting to do for the veteran patient populations in PTSD and traumatic brain injury. I think that, you know, conversations like this open the door. Dr. Gutierrez, you're one of the nation's experts in treating long COVID. And if you think that there seems to be a signal there, who, who are other people to disagree? That's how I feel about the patients that I see with long COVID. It's how I feel about patients who suffer from symptoms after a traumatic brain injury or a concussion. It's like, hey, like there is a signal here and this makes sense. And in the correct setting, in the correct clinical setting, it is safe. I think we also have to make a note of that. Like these are still Schedule 1 substances, which is a barrier to research as well. But, the last thing I want to do is make a patient who's already suffering. I don't want to make their life more difficult by, through their desperation, trying to seek out like your cousin's buddy who grows mushrooms like in the back alley. Like this set and setting is really important, and these do open up the avenues of neuroplasticity. And it would be very naive of us to think that neuroplasticity can only go one way. Because if patients do this in a set and setting that is not conducive to them feeling safe, or a setting conducive to them feel it's like not a healing setting, then that worries me. That makes, they're vulnerable patients in an even more vulnerable state. And if we don't have the infrastructure to support them through that, that's where I think we can have negative outcomes with this. And I'm really passionate and really hopeful for this. And so I want it done the right way. And I want patients to have good experiences and get better when in that setting.
I think if we extrapolate from best evidence informed practices from both indigenous communities, the underground communities, and obviously what we see in neurorehabilitation and similar allied practices, those almost always seem to kind of fall along similar things where we have a safe container and good practitioners that are close by and well informed about this particular patient's history. So I know we're at a hard out right now, and I just want to say in closing, thank you all very, very much. Kind of going back to what Dr. Gutierrez says, within the Psychedelics and Pain Association, there's a huge amount of excitement about this, and I think there are people that are paying attention closely to this outcome who have personal investment in it, and speaking to that also, just everyone in general, just, our gratitude again to Psychedelics Today for hosting this and contributing to this. Joe Moore has been following this very closely. The River Styx Foundation, Cluster Busters, all of them, have been following MaryAnn's case with everything. And we're desperately excited to hear that, Joel, you were joining this. I'll just say I was terrified to approach Dr. Gutierrez with this originally. And she's been nothing but kind and welcoming and encouraging. And it's hard to argue.
It's because we're PM&R physicians. It's because we're PM&R physicians.
Open-minded. We're yeah, we want to do things. We want to fix things.
It's wonderful. So just once again, thank you all. In closing, does anyone have a last final thought? I know you have to go.
Hey, thanks again, MaryAnn. Thanks for your courage. I really hope that this story can spur further research to help as many people as we possibly can.
And of course, thank you to all of you too. Like this, this is all happening because of the work of the doctors involved. So Monica, Joel, thank you very much for this. And Court, thank you.
Yeah, Court's a great connector and persistent on social media.
Yes.
I try.
Thank you.
Okay, everyone. Thank you all so much.
Great talk. Enjoyed it. Loved it.
Thanks.
Thank you.